Hi, welcome once again to Senior Focus. I'm your host, Bill Adams, and we come to you a couple times each month through the good graces of Armstrong's Channel 20 and 100. And again, thanks to Greg Roden from the community channel on Armstrong. Also, thanks to Keith Kaiser here at Mill Creek Park. We're, of course, coming to you from the Davis Center. And today is so beautiful. We're outside overlooking Lake Glacier on a nice day. And if you haven't been to Mill Creek Park for a while, it's a great park. It goes all the way from well, they've got places all over Mahoning County. It's the Mill Creek Metro Parks. But please come to the Davis Center because there's always something to do here. And today we're going to be talking with a guest who's been on the show multiple times, I think.
Yes.
Dr. Figliano, Dr. Sheryl Figliano, is with the Centers for Hearing Care, and welcome.
Thank you, thank you. I was also admiring the gardens here. They're just outstanding, and as Bill said, if you haven't been, fall is the time to come out and really enjoy those colors.
And we're going to talk today about the Centers for Hearing Care and about the work you do with hearing, not only hearing loss, but on the positive side, hearing improvement. And why don't we talk about, I guess, maybe some of the basics of what can happen with seniors, especially people over my age or around my age and over 50. And as we get older, what are some of the things you see?
Well, I would think the number one thing that we see is people in general not having regular physicals. And you may be going in to see your family doctor having that regular physical, but not maybe to some specialists like an audiologist to get your hearing checked. It's something that's very overlooked. When you go in to see your family doctor, he's very concerned about your blood pressure, the medicines you're taking, your cholesterol levels, but hearing is always put on the back burner because it's considered, it's not life-threatening, but it is a quality of life issue. And many of you know, being in the family doctor's office, that the waiting room is full. Either people are there getting checkups or they're ill. And many times the physician is very far behind. So he wants to take care of those points that are life-threatening or urgent, and maybe not things that are our quality of life, like hearing. But our hearing tells us so much about other parts of the body that a very, very simple hearing test can tell us a lot about more than just hearing. And when you say what kinds of things do we see, well, one is earwax. Earwax is something that as we get older, it's very hard for our bodies to rid it itself. And people will come in thinking they have a very large hearing loss and their ears are just completely plugged with wax.
Oh.
Now, I challenge you to think about the last time you were in to see your family doctor. Did he even look in your ears?
That's a
or
good
she?
question.
And again, it's not out of neglect, it's out of worrying about things that are more life-threatening and maybe a higher priority than something simple like earwax.
Sure.
But patients will come into us thinking that, boy, I've really got this serious issue. We clean their ears and they're thrilled. Say, gee, that's all it took, and I got my hearing back.
Right.
So that's certainly a positive when that happens. But there are other things that we acquire as we get older that cause us to have more issues with our hearing. Hearing doesn't just get bad because we're getting old, and sometimes people will tell you that. Well, I'm getting older, I'm sure I have hearing loss, but we see people in their 90s that have normal hearing. So we know that hearing loss doesn't get worse just because we're old. But as we get older, we acquire things like sugar diabetes and kidney disorders, thyroid problems, circulation problems, and all of those things cumulatively or on their own can add to hearing loss. So getting back to what I mentioned earlier, why is that baseline test so important? If we don't know what your hearing is like today, we have nothing to compare it to down the road.
Okay.
So you may go into your doctor and say, I've had this problem for quite a while. Well, how long? When did it happen? Is it because of a medication that you're on now? Or is it something that you've had all your life? And without that baseline test, the doctor doesn't know. The doctor can't answer that question.
So as you're saying, it's a good idea, again, say you're in your 60s or 70s, to go in and get a test, and that way, from that point on, you could monitor, just like I guess with any medical condition.
Right.
Is it getting better? Is it getting worse? Or is it pretty much leveling off?
Right.
So you do a hearing test as part of your initial consultation with someone?
Right. First looking in the ears, again,
Right.
because
For the wax.
for the wax.
Which is it.
And then the simple exam, which tells us a lot about the body.
And again, just to allay anybody's fears, when you do a test like that, there's no pain or anything involved, right?
No
it's a
pain.
simple. Well, what just describe maybe some of the
Right.
things you might do.
Right. Well, as Bill mentioned, there's no pain involved. Most all insurances pay for it. So the first question people generally ask is, well, how much of this comes out of my pocket? And most all insurances do pay for a simple hearing test once a year. But we put some headphones on. We play some sounds in your ears. We're either going to have you raise your hand when you hear the sound or press a little button. And we do it at several different pitches or frequencies. And it gives us a, excuse me, an overall idea of what your hearing is like. Now, patients will say to us, well, I don't listen to those beeping sounds. I'm not sure why you use those sounds. I want to know how I'm understanding speech, or why I can't hear my wife when I'm in the living room and she's in the kitchen. And the pitches or frequencies that we use are vowel and consonant sounds.
Okay.
The high frequency sounds are the consonants, where our speech gets its clarity, and the low pitch or low frequency sounds are vowel sounds, where our speech gets its volume. So many times people can hear, but they don't understand. And that tells me that they hear those low frequency sounds very well, but they don't hear the high pitched sounds, and it makes people sound like they're mumbling.
Okay.
So that simple test takes maybe 5 minutes. It gives us a lot of information about the potential of someone to understand speech. We then do some speech discrimination or speech understanding tests. Again, very simple. We repeat words. We say words and the patient repeats them back. And we do it at a nice, comfortably loud level to see what the person's potential is with a hearing aid. If I put a hearing aid in your ear and it's at a nice, comfortably loud volume, how well are you going to understand? And we can tell you that day, if you got a hearing aid, this is how well you're going to do. In most cases, it's very, very well. In some cases, depending upon why the ear was damaged or how it was damaged or how severe the nerve is damaged, it's not always good news. We need to tell the patient that even with a hearing aid, you're still going to have a lot of difficulty. But at least the person has some realistic expectations of how well they're going to do should they decide to get hearing aids.
And with the majority of people, would you say, though, that you are able to maybe use a hearing aid with, is that enough for them? Basically, just having a hearing aid would be enough?
Absolutely. I would say 99% of the time, and it's a very accurate number. Hearing aids have come so far over the past several years that losses that we weren't able to help in the past, we're very easily able to help now because of computer technology and digital hearing aids.